Good afternoon there, Wanna Go Fit fam. I am Keyuna, your friendly neighborhood trainer. Happy Sunday. I know. I'm working on a Sunday. Yes, I am. Because I had to bring you this information, honey. We need to make sure that we knew what was happening. Now, not sure if you are aware, but it is Heart Healthy Month. With that being said, you know what we do? We bring you the information. So we wanted to go and hear it from the horse's mouth what you're supposed to do to make sure that that ticker is ticking correctly. So without further ado, let's introduce our esteemed guest, Dr. Van Adamson. Golf clap.
Thank you. Thank you so much. It's really a pleasure to be here. Heart Healthy Month is dear to my heart as, as I am a cardiologist. A little bit about myself. I am originally from, I know. I'm originally from South Carolina and grew up in a small town called Spartanburg. Went to college at the Morehouse College in Atlanta, Georgia,
I know that.
where then I matriculated through there and ended up at Case Western and got my medical degree and my master's in applied anatomy in about 4 years. And then I was off to the military. I spent 14 years in the military total, where I did internal medicine and cardiology. And then got out in 2019 and decided to open something in Cibolo. So my clinic here is called Cardiology First Clinic. You can search for me just by my name, Van Adamson, MD. I am actively taking patients, TRICARE, Medicare, all commercial insurances. If you have any questions, I do have a special niche where I believe that exercise comes first and everything else is built on top of that. So I really do push exercise and life-changing things first and medications only as needed. I try to tell patients medicine can act as a bridge while you're getting yourself together. And then once you get yourself together, you can get off the medications. So I try to live the life that I talk about. So I try to stay fit, try to look and act the part. And I'm here to just provide any knowledge or answer any questions that people might have.
Nice. I like it. He said he not only talks the talk, but he walks the walk. That is
Absolutely.
fabulous. That's what the people need. What we have is, we have a recipe that works for us, right? We all have our own individual recipes. What I like that you said was the medication is a bridge. It is not a band-aid. It is a bridge. So tell me, a lot of people, they don't always make it, of course, to their annual checkups and things. So just from an annual checkup, what can you find out about your cardiac health just from your annual checkup?
Right. All right. So when you come to see me, it's comprehensive. So for people that I see once a year, that I see for the first time, everybody gets an echocardiogram. So an echocardiogram is just like for women who have been pregnant, you get an ultrasound of your baby. I'm going to get an ultrasound of your heart. That ultrasound of your heart is going to tell me several things. So depending on the thickness or the width of the heart muscle, it tells me whether you have obstructive sleep apnea. It tells me whether you have uncontrolled high blood pressure. From looking at your heart valves and how they open and close, it can give me an idea of the strain and stress that the heart is under, because those valves can begin to leak. And when we say leak, valves are like doors. They're only supposed to open one way and only supposed to allow blood to go one way. When I see blood going in the opposite direction, it tells me that those valves have been under a lot of stress. I can also tell whether or not your heart blood vessels are enlarged by measuring them. So there are a lot of things that I can tell from the first visit just about the structure of the heart. Then I sit down and I have conversations with you about your sleep, about your exercise, If we have labs, we go over labs. During that visit, I'm going to get a pretty keen assessment of where you stand in terms of your goals. I think of myself as a navigator, and it's your ship. You're the captain. You're Captain Kirk. For me, it really is about making sure that whatever goals you have, I do what I can do to help you attain those goals. So we talk about exercise, we talk about diet, we talk about the things that you find most difficult to overcome, and we try to plan out a way to help you overcome those obstacles and reach your goals. Did I lose you? Indeed. Hey, we back?
I am back. I am back. I forgot Sundays is when everybody is streaming everything,
Oh,
which makes the signal a little crazy.
okay.
Mm-hmm.
So I think,
Mm-hmm. Yeah. No one will anymore. So there you have it.
all right. So what's the last thing you
Now,
heard?
where we left off, I asked about your regular
Yeah,
checkups and so forth, and you were going through what the checks actually what they showed and what you could see from that, what red
absolutely.
flags came about. So if you could, just because we, got
Yeah,
disconnected, go through again for me, please.
absolutely. So I think when we got disconnected, we were talking about an ultrasound of the heart and what that ultrasound can show. That ultrasound shows the thickness of the heart. The thickness of the heart is, how muscular the heart muscle actually is. So I kind of explain people like conditions like high blood pressure or having sleep apnea and not wearing the CPAP machine is like your heart's lifting weights. So if you want to get muscular, you want your muscles to grow, you go to the gym, you work out, you lift heavy weights. Well, the same thing happens to your heart when you have high blood pressure and sleep apnea is not treated. It's like your heart is lifting weights. Every heartbeat, your heart is lifting weights. Why? Because it's pushing against the pressure. The pressure, your blood pressure, is the weights that your heart have to move in order to move blood out of the heart. So when we get your blood pressure down, that causes the heart not to have to work as hard and makes it actually last longer. High blood pressure is the silent killer for a reason because most people don't feel anything until your organs are destroyed. So in those visits, we look at the echo. Then I listen to you, listen to your heart, listen to your lungs, listen to your neck, do an exam of your legs because your blood vessels run throughout your body. And I am a vascular cardiologist. So what that means is I care not just about your heart, I also care about your blood vessels. So I treat and manage varicose veins. So women who have varicose veins or signs of them, we talk about how to manage those. I manage people who have blocked arteries in their legs. We talk about the management of those at that visit. And I think the main thing for me to understand as a provider is what are your goals? So remember, we talked about that bridge. Well, medicine is a bridge because my job is to figure out what your goals are and how to motivate you to make changes in your health that improve your overall life. I told people that medicines are there and have been here to keep us alive because we no longer walk to the grocery store. We drive now. We buy a lot more processed foods. Nobody, grows their foods anymore. So all of these extra things that we add into our lives actually are a detriment to us staying fit. So, I'd be happy to talk more about those things as we go further. But for me, when you come and see me, you're going to get an overall physical, unless you come to me with a specific problem. But I'm going to talk about everything, screening, all the things we need to do to ensure that everything is good to go for the next year.
I can't even tell you how mind blowing it is that you went when you said to the neck. I said, neck? What do you mean? And then your legs. But you're right. I guess I never paid any attention to people who had like varicose veins and things of that nature. Um, People now, just this is for my own curiosity at this point. How how severe or yeah, how severe is varicose veins to as far as on scale of having heart disease? What does how what amount of risk does a person have if they have varicose veins?
All right. So varicose veins, depending on the cause, and we're just gonna say garden variety varicose veins. So what does it mean to have varicose veins? So varicose veins are a sign that you have high blood pressure below the waist. That means that the veins that are trying to move blood back to the heart, they're finding that the pressure is very, very high that they have to fight against in order to get blood back up to the heart. Well, how does blood move from the heart, from the legs back to the heart? Well, it's by a series of doors, and these doors look like valves. So your heart squeezes, blood in your toes moves to your ankles, a door opens, the valve, and then when blood tries to go back to your toes from your ankle, that door closes, preventing blood from going in the wrong direction. When you have varicose veins, most of those valves from your toes to your hips are gone, which means that all that blood, when you stand, when you sit, it rests in your feet. So, what ends up happening, most people complain of tightness in their feet, tightness in their legs when they stand. Most people never even see the veins. They complain of shiny, tight legs. They complain that their legs get tired easy when they walk or when they stand. They can't stand as long because their legs hurt. Sometimes they complain of itchiness in the legs. Their skin will be dry. These are all signs, and swelling. Swelling is also a major sign. So if you worked as a hairdresser, you worked in retail, you worked at a desk for a prolonged period for years, you are likely to have significant varicose veins or at least veins that are refluxing, which means veins where the doors are broken. So if you have those symptoms and you have swelling, you should definitely see. Uh, it's difficult, and the reason it's difficult is this: vein treatment centers treat your veins. They don't treat you as the individual. If you come and see me as a cardiologist, I am going to treat everything. So, what I would say is go to someone who is competent in treating the entire person. If your veins are your only issue, vein centers are fine. But if you have cholesterol, high blood pressure, and you have issues with your veins, you should probably be managed by a person who specializes in treating all of those things. We are some of our parts, but we're not just parts, we're people. So I treat the whole entire person.
Right, right. I think that's where I think that's where people kind of get a little hung up on the whole, I guess, checking or their issues. They feel like I mean, just being honest, big farm. In our minds, and it's all these documentaries, all this information out there. It's like, hey, big farm says get on the pills. The pills are what's going to, keep you going. And I definitely think that we rely too much on them because, as you said, we're like, all right, well, if something happens, we could just take a pill for that, versus backtracking of your conversation when you said you believe in exercise and walking the walk, right? Making
I
sure
do.
that we actually get in the physical exercise, that we eat less processed food, so forth. That really kind of makes the difference versus putting the band-aid on it, like you said, letting it act as the bridge. Now, cholesterol, because let me tell you something. I remember when I was a kid, I had high cholesterol. And I had high cholesterol because, well, I'm from Maryland. So, Baltimore,
Hmm.
we had seafood, baby. So that's what I ate. I love seafood. I love cheese. So that kind of, because I was a very active kid. I wasn't overweight or anything. However, my diet, was consisted of not and I can't really say a lot of processed foods, but definitely my mom wasn't a cook. So probably more than what I needed. Now, for someone like me who, I was a child, like you said, through my diet is where I developed high cholesterol, and through my annual visit is how I knew that, or how my mom knew that I had high cholesterol. Now, would there be any other way to know that your cholesterol was high if you did not get these checks? And second, we know that we could take a pill and it could be a bridge, right, until we get back on it. However, is it a point of being gone too far where the bridge is not a bridge, is now a crutch?
So, cholesterol is is very difficult to pin down sometimes. So what I mean by that is there are some people who have genetic conditions that predispose them to having high cholesterol, which means that there's not any amount of exercise that they're going to be able to do to improve their cholesterol. Now, for most people you're going to meet on the street, it's not an issue of their genes, it's an issue of what's in their genes. It's an issue that they like to eat and they don't like to exercise. So most of the time, it's not the genes inside you that's the issue. It's the genes that you're in that's the issue. So cholesterol, no, there is not really a way to know that your cholesterol is high unless you get it checked. And the American College of Cardiology says that, at about age 35 or 40, that needs to become part of your routine yearly physical. And what I tell people is cholesterol, diabetes, and high blood pressure for about 65% of people is going to track your weight. As your weight goes up, you will become more insulin resistant, which means that your blood sugars resting will be higher, your cholesterol will be higher, and your blood pressure will be higher for most individuals. So the individuals that I am talking about are the individuals that are between the ages of 30 and 50. If you develop high blood pressure when you're 20, you're a completely different animal. Okay. That is almost certainly genetic to some degree. Your mother, your father, your brothers will likely have high blood pressure in their 20s.
Okay.
But if you're between ages 30 and 50 and you're developing these conditions and you notice that your weight is going up, exercise and diet is the right thing for you. So I'm gonna let me see. I'm gonna show something really fast. If I can share my screen, let me see. I can get this thing to work. Let's see, entire screen. Okay. So this is directly, let me know when you can see it, but this is directly from the American College of Cardiology. And the first thing I tell people is the majority of your weight gain and problems come from what you put in your mouth. So I'm going to give you a small anecdote for me. It is even as simple as the types of pots and pans you cook with. I know we say that a lot of these pots and pans have like this Teflon coating, but if that Teflon coating starts to come off in the pans that you're cooking in, because you use like forks and stuff like that that rub up against it and cause the Teflon to come off, under that is poison. Under that Teflon coating is poison. And if you are continuously cooking, you are ingesting that. And I didn't realize that for the last year and a half, but I had a lot of joint issues, a lot of issues. And why am I so inflamed? Well, a good friend of mine bought me some new cookware and I started cooking with that. And a lot of issues I had started to go away. So it is not only what you cook, it's what you cook with. So Mediterranean diet is what I recommend to most of my patients who are not really salt sensitive. Most people who have high cholesterol are salt sensitive, but increasing your whole grains, increasing your poultry, increasing your fish, vegetables, fruits, olive oils, low dairy fats, and kind of removing the sweet foods out of your diet. So how does this work in a way that's beneficial? For one, processed foods are your highest amount of saturated fats and salts. By getting rid of those, removing those out of your diet and replacing those bad fats with good fats, the olive oils, the fish, the poultry, you're going to change the chemistry of your cholesterol. Your HDL will increase. Your LDL, which is your bad cholesterol, will come down. And your blood pressures will also come down because you're removing a lot of the salt. So that's one thing. And then the second thing really is exercise. And exercise is key simply because when you're exercising, you are stimulating your body to do the things that it needs to do in order to be healthier. So exercise from the American College of Cardiology says that you should do 150 minutes of moderate exercise. What is moderate exercise? That could be walking on a treadmill for 30 minutes. What I tell people is this: if you don't sweat while you're doing it, it's not enough. You know, I am not asking you to pass out at the end of the workout, but you at least got to sweat. I see you shaking your head. You know, you're not burning any calories if you're not sweating. So you have to sweat. So if you can lose 20%, start off with 10, but if you can lose 20% of your body weight, most people between the ages of 30 and 50 can reverse diabetes, reverse high cholesterol, reverse high cholesterol, diabetes, and what's the other thing? And high blood pressure. And when you reverse those, you'll find that you'll get healthier. And I think that that's why medicine can be a bridge, but you got to put in the work. And that's the hard thing.
That is the hard thing. The hardest thing, I think, really is we know what to do, but we don't want to do it. When we began prior to this, you said, well, what do you want to talk about? I said, well, you know, let's talk about the basics. I said, we know that people already probably know this information is key. And that's just because we don't do what we know to do. We know it and we can tell somebody else about it. However, doing it ourselves is typically where we fall short.
It is difficult. It is difficult. Yeah. I tell my patients that, you know, it is It is the rest of your life. It is a marathon. It's not a sprint. You will have days when you fall back. You'll have days when you're motivated, days when you're not. It is okay to live life and enjoy things in moderation. Everybody does. That's why you're put here. You're put here to enjoy the fruits of your labor.
Moderation.
Exactly. And I think if you get out there and you work hard and you lose 5 pounds over a month and a half, it's okay to have some cake. It's okay to reward yourself. So doing things that keep you motivated, you got to do it.
I definitely agree with the motivation. A lot of times, like you said, we're just going through life doing things, just doing things. There's no why behind it. There's no purpose behind it. I was reminded not too long ago that I always say, well, I'm single, I don't have anybody to take care of, just these dogs or so forth. However, hello, I have me,
Yeah,
right?
you.
I have Keyuna to take care of. So
Absolutely.
I once I realized that, I just had to bring it back in. And what you were saying as far as, what you were eating, I realized that my lifestyle had kind of got so fast paced that I was eating out more. I was doing things that were definitely counterproductive. And I
Mhm.
know that if my blood sugar or my levels would have got checked a month ago, honey, what it would tell, let me tell you. So glad to be back on track with that because I know better. I definitely
Mhm.
know better.
Most
Now,
of us
what
do.
happens when you have someone who hasn't gotten on track, has is just taking the medication but not necessarily um eating like they're supposed to, or putting in the work and getting their daily activity and just pretty much living the same lifestyle that they were living before, to include, as you mentioned, not as far as sleep, not getting enough sleep, not eating correctly, not exercising. Now, but they're taking their pills. So, how does this person play as far as risk factor for living a little bit longer or a better rest of their life?
All right. Yeah. So I think it's important to understand that medications make you live longer, but they don't make you live better. So if you are taking your high blood pressure medication, you're taking your cholesterol medication, you're taking your aspirin and all those things, they do not supplant or take the place of exercise. A body in motion stays in motion. When you are taking your medications, but you're sitting on the couch eating all these fried foods and not exercising, you are still doing damage to your body. The medicine is just keeping that damage at bay. So the first thing I always ask people, well, what are your barriers to doing what you need to do? And I think that's very important because when I talk to people about stopping smoking, the first question I always ask them, are you addicted to smoking or are you addicted to nicotine? There is a difference. People who are addicted to smoking, if they go into the hospital for 5 or 6 days, they don't crave a cigarette at all. It's when they go home and they wake up in the morning and they have their morning coffee, or when they go to their job and their friends go out on a smoke break and they go out with them. Those individuals are not addicted to nicotine, they're addicted to the habit of smoking. A person who is addicted to nicotine, when they go 24 to 48 hours without nicotine, you don't want to be anywhere around them because they are hard to get along with because they are withdrawing, and withdrawing is hard. So, barriers to success are always important to understand as a provider who wants the best for your patients. There are some barriers you're not going to be able to get past, which means that if you have a single mother with 3 kids working a full time job and she's active in her kids' life, she may not be able to get to the gym 3 days a week. So in some cases, what I tell people is if you want something to become a lifestyle, you got to do a little bit every day. So I used to challenge my patients to do 1 minute of exercise the first week, and this is 5 days a week, 2 minutes of exercise the second week, 3 minutes of exercise the third week every day. So by the time you get to 30 minutes a day, you're on week 30, and it's become part of you because you've done it every day, 5 days a week, and
I
you
like
slowly work
that.
your way into it. And for me, it is really about making small steps in order to get to the goal. So that's one of the things that I do with patients. I just try to identify barriers.
I really like that. I mean, you know, when you said the 1 minute and 2 minutes, I'm like, man, what is that going to do? In my mind, I'm like, you had me for a moment, but you kind of losing me, homie. You know what I mean? But however, I think it is a brilliant idea. It is a brilliant idea because that affords people the opportunity to make it to where it fits into their schedule. You know, they're conscious about it. Like, man, come on. And your mind. I have a client. My client says, I my rule is anybody can do anything for 1 minute. You know,
I agree.
so
Hmm.
just with that mindset, that is a fabulous approach. A
Hmm.
fabulous approach. I I love it. I'm not even gonna lie, homie. I'm gonna have to pick that from you. So if you run into one of my people and they say, "Girl, I work with Keyuna and Wanna Go Fit," and they said she had me exercise for 1 minute. You know where I got it from? I don't want to hear it. We have it on camera. I'm taking it. Okay, so
Absolutely.
that's what we're doing.
I mean, yeah, I mean,
But I
there
want to
really is.
say, um, I like how you act the lifestyle.
Yeah, there really is no barrier to doing something for 1 minute. And once you get them used to doing it and they're building up over the weeks, it becomes very, very easy. And then you're up to 10 minutes at 10 weeks, and you're like, hey, I'm just used to doing this now. And then most people skip, they go from 10 minutes to 20 minutes. And maybe they can't do 20 minutes every day. Maybe they can do 10 minutes one day and 20 minutes the next day. But it's better than what they were doing 10 weeks ago, which was nothing. So,
Right. Right.
so.
Exactly. 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 Okay. Well, just being honest, you really answered my questions. I wanted to make sure that I we talked about how lifestyle influences our, like you said, our cardiac health. And you definitely explained that. I want to go back and touch a moment on the sleep. You gave an excellent example about how when you were sleeping with by not using the sleep apnea machine that some people are prescribed to use, how it kind of is like your muscles just struggling and doing those push-ups like that. Now what if people have not been diagnosed with sleep apnea? What if they do not know that they have anything, however, they don't sleep well? How is that playing a part in their as far as them getting rejuvenated and their heart health?
Absolutely. So whenever someone comes and sees me, I ask about 5 or 6 questions to identify people who have sleep apnea. The first question I ask them is, has anyone ever told you snore? Now, everybody that snores doesn't have sleep apnea, but it's a clue to the fact that there is obstruction. There's a block in their ability to breathe out and breathe in effectively. The second thing is, do you wake up with morning headaches? If you wake up with morning headaches, that's because you're not exchanging carbon dioxide and oxygen the way that you're supposed to. If you sleep for 8 or 9 hours, and you feel like you haven't even slept, that is another sign that you're not getting good sleep. And that can be for multiple different reasons. I have 60 and 70-year-old men who get up and go to the bathroom 3 to 4 times a night. So that's a thing that compounds their ability to get good sleep. How many times you go to the bathroom at night? So, and the last thing is do you want to nap during the day? Like, are you so fatigued and tired by 12 o'clock that you want to go to sleep? If you do want to go to sleep by mid-afternoon and your brain is not functioning, it's because you didn't get good rest the following night before. Some other questions that I ask: if you sat in front of the TV, would you go to sleep within 30 minutes? Do you want to nap after lunch every day without alcohol? Have you ever gone to sleep in a public place? Do you like church? People might go to sleep in church for multiple reasons, but that's one of the things I ask them. The second thing is, have you ever fallen asleep at a stoplight? Have you ever fallen asleep while someone is speaking to you? If you have several of these things, you more than likely have some type of sleep disorder. And then there's another thing called sleep hygiene. So for those that don't have obstructive sleep apnea, a lot of us have bad sleep hygiene. So what is sleep hygiene? Sleep hygiene really is about preparing for sleep every night. So what does that mean? Not watching TV before you go to bed, going to bed in a dark room, ensuring that your bedroom is only used for 2 things: sleep and sex. There are people who read in their beds. There are people that do homework in their bed. There are people that do bills in their bed. None of that is conducive to sleeping. So having a night routine, not drinking caffeine, not exercising within 2 hours before going to bed, making sure that if you need white noise or you need some type of ambiance in order to put yourself in the mood for sleeping. Try to remove the stress of the day prior to going to sleep, and trying to schedule going to sleep every night at the same time. All of those things make you successful in sleep. And if you noticed, everything I've just said to you are all things that you can do in your daily life. Like, for instance, if you're in school, most of those things I've told you, do the same thing every day. Study at the same time. Don't do things that distract you from studying. Go to a place where all you do is study. So when you walk in that room, your mind flips to study mode. It's the same exact thing with sleep. It's preparation. You have to prepare to have good sleep. And if you have obstructive sleep apnea, wearing your CPAP is all about that preparation.
Wow. Like you said, we all know it. We all know it. These are things that they have been talking about for I don't know how many years. Only sleep in your bed, no TV before bed. All of these things. Now is put your phone down, right? Put your phone down.
Yeah.
Don't be on your phone. And again, we know it. Do we do it? No. 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 We don't. We don't. So, I mean, we already just said the basics, right? Eat like you're supposed to. Don't eat too much processed foods. Exercise. I really like the way that you put that, sleep hygiene. That is amazing term. And just because automatically I feel like by using that term, you put people in the mind of this is something that has to happen, unless you are a nasty individual. Because if that's the case, you're daggone sure only using that bed for sleep. You wash your behind, right? So having good hygiene means that you are consistently doing what you need to do to take care of yourself on a daily basis, on a regular basis. So saying sleep hygiene, oh, That's great.
Mhm.
I like it. Again, that's one of them ones I'm gonna have to say, hey, my man Dr.
All
Van
right.
Amberson said, you better practice good sleep hygiene. Okay, I'm gonna quote you on
Absolutely.
that one.
All right. All right. Yeah. So yeah, I think that once again, health is
Wow.
360 degrees. You have to see providers that care about everything. And even as far as mental health, even though I'm not a mental health specialist, but I even understand the difficulty of mental health. I'm also coming to understand more the difficulty of perimenopausal and menopausal women in terms of heart health, exercise, diet, and how their
Mm.
hormones play a role. So I have kind of this team that I'm
Mm.
developing around me that, depending on who's sitting in my office and what they're talking to me about, I have specialists that I can send them to that can help them, as become a total individual, complete health hygiene, not just cardiology, but mental health, physical health, cardiovascular health, peripheral arteries and vein health, all of that stuff.
I love it. Of course, I'm a little, biased because I am one of those perimenopausal women. So I may have a little bit of bias there. However, I think that is great. I did a event a couple of weeks ago, and that was the pretty much the reigning tone was one, make sure that you have a provider or providers that care and listen to you. Because a lot of times, as you said, we are kind of on the conveyor belt, right? All
Mhm.
right, next one, next one, next one. We're just kind of going through the motions. Now, we've all been there, and no one really likes to be there because in the end, you're not getting what you need, as an individual. Like you said, we're getting band-aids instead of bridges.
Yeah.
So I love how you're able to identify that, yeah, maybe this doesn't this approach doesn't work with her because of this, or it doesn't work with him because of
Mhm.
this. That's really, I feel like, where we need to be, because like you said, big farm has definitely made it to where, oh, we could take a pill for that, and we're programmed to do so. However, having this awesome team of medical professionals to say, hey, and we actually mentioned, how awesome would it be if all of your medical team consulted each other? Like if there was one system that your everybody could talk, so you could look and see, well, you were treated for this, so this may be the cause of this, and so forth, or whatever, and then y'all could maybe confer on things that were just a mystery, and come together and say, well, no, this is the solution for this. So I mean, I like the way the team effort that you're trying to create there, or I'm not going to say trying, I don't like trying, that you are creating there. I like that. That's awesome. I think that's what we more what we need. That's what we need. Um, okay, so like I said, we already talked about it: cholesterol, sleep, diet, exercise. That's what it is. Any closing remarks or anything? I always like to give people, because everybody has a motto. Mine is saving the world 1 pound at a time. However, I
Mhm.
need to change mine because it has extended past weight. I not only care about what you look like on the scale. Now the entire person is my mission. So I may have to change that. But what would be your motto, your advice, taking us out on this Sunday afternoon?
Find a doctor that cares about what you care about, but also cares about what's important to make sure that you are long-term successful in your health goals. So what I mean by that is as I said before, and if you read my bio, I say it, I am a navigator. You're the captain. I give you options. You tell me which way you want to go. Simple as that. Because at the end of the day, you have to put the work in. All I can do is tell you what results you can expect from the work that you put in.
I love it. I love it. Like you said, that's where we're all at this point, and as humans anyway. We're navigating through life. So if
Absolutely.
someone can, give you some sort of roadmap, right? Or just some guidance, I think that, we will all do a little better. And of course, accountability. As you said, put in the work. Are you putting in the work? I I love my dentist. I've been going to the same dentist for, I don't know, 10 or plus years, I guess, at this point.
Mm-hmm.
And they love me because when I come, they say, whatever they tell me that I should address, I'm like,
Yes, sir.
got it. And when I come back, they're like, oh, wow,
Mm-hmm.
you're the professional. Why would I question what you have to say? If you have proven that you care about my health. These people know my children.
Mm-hmm.
They still ask about them and
Right.
they've moved away. But they care about me as a person and not just
Mhm.
the teeth in my mouth. And these are all mine. And my goal is to leave here with all my own teeth. FYI,
Good goal.
sidebar.
Good goal.
Yes. But so that is like, right? But that's what I just, like you said, I think every professional that actually takes the time to listen to their patients, that listen to their clients, because it is very easy to give conveyor belt service if there's no care. So I thank you, Dr.
Thank
Adamson,
you.
for sharing your Sunday afternoon with the Wanna Go Fit fam. I apologize
Thank
for
you for
all
having
of
me.
the technical difficulties again. I forgot people. How about that?
Hey, any winning road isn't straight. So thank you for your
Very
time.
nice. All right, for jumping on board. Once again, please let everyone
Bye
know
bye.
how to get in touch with you once again, and we'll say goodbye from there.
All right. If you want to reach out to me, you can reach out to me at www.cardiologyfirstclinic.com, or you can search Van Adamson, MD, in Cibolo, Texas, and I'll come up. Thank you so much. Y'all have a great evening. Bye bye, Keyuna.
Awesome. Thank you guys for participating. Please do like and subscribe, share this. We will be bringing you more information in the future. Have a good one.